Please welcome Jenna Daugherty, Divisional Vice President, Global Citizenship and Sustainability at Abbott, to introduce the next panel, The Future is Healthy.
Hello, and thank you everyone for joining us today. At Abbott, we are very proud to support today's symposium and the broader Women, Equity, and Global Development Forum. It is vitally important that we advance the broader dialogue on equity and inclusion, and we're looking forward to an engaging conversation right now on the future of equity in health. Central to this discussion is a really important fact that's often overlooked. Health is not just determined by the amount of exercise that we get or the diet that we have or the number of doctor's visits that we make. Our health is influenced in large part by a number of factors outside of our personal control. The major social and economic challenges related to poor health also are referred to as the social determinants of health. These are conditions in our everyday environment, so where we're born, where we live, learn, work, play, and age, that affect a wide range of health outcomes and risks. And these challenges include poverty, unequal access to quality health care, education, stigma, racism, etc. And so just because these things often feel outside of our personal control doesn't mean we are powerless. And by working together, we know that we can affect change, and that starts with dialogue, which is why we are bringing together today some of the leaders in this movement who are going to talk about how we can build a better, healthier future together. I'll introduce them briefly. Lisa Hinton on the end was recently named Metro Chicago Executive Director of the American Heart Association. She has 14 years of nonprofit fundraising and management experience. The AHA has a strong focus on equity, which we know at Abbott firsthand through our new partnership that we've launched last year supporting the Andaleo Institute's important health education work on the far south side of Chicago in the Washington Heights community as just one example of their broader work to deliver health equity. In the middle, we have Clarita Santos, who's the Executive Director of Health Initiatives, Community Health Initiatives at Blue Cross Blue Shield of Illinois, where she oversees their statewide community engagement, including the launch of a really exciting Blue Door Neighborhood Center, the community's first community-based health and wellness center. And finally, our moderator, Dr. Helene Gayle, who is the President and Chief Executive Officer of the Chicago Community Trust, one of the nation's leading community foundations. Dr. Gayle was named as Forbes' 100 Most Powerful Women, and she's also authored numerous articles on global and domestic, yeah, that's right. Yes. She's authored numerous articles on global and domestic public health issues, poverty alleviation, gender equality, social justice. As with the other panels, you can ask questions via the meeting pulse, or for those of you in the room, can raise your hand afterwards. So please, a warm welcome to our speakers.
Thank you so much for those kind introductions. How many of you have heard of the social determinants of health? Great. Well, that's more than many people. You know, it reminds me of a quote, and I'll read this quote. It was a quote from Dr. Martin Luther King that is often misquoted, and the misquote is, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. What he actually said was, of all the forms of inequality, injustice in health is the most shocking and inhuman. And I think it puts the point on what we're going to talk about today, that so often when we talk about health, we talk about health care, and we put a focus on, are we evolving our health care systems? And people may go a little bit further and talk about community health. Are we extending health care into the communities? But when we think about what it takes to be healthy, it's a very different ballgame, and we're talking about very different factors. And so when we think about what leads to disparities in health, we recognize that genetics contributes a certain portion, Healthcare contributes a certain portion, but actually the largest portion of what leads to disparities and inequality in health are actually whether you have access to a job, good adequate nutrition, safe neighborhoods, education, et cetera. And so we're going to talk about what that means and how that comes alive. And maybe just start with, in your world and in what you're doing, how do you think about the social determinants of health and how are you seeing that playing out?
Sure, absolutely. So, hit it right on the head. We, at the American Heart Association, we set an impact goal every 10 years. And for our 2020 impact goal, we were really looking to try to improve cardiovascular health and reduce deaths by 20% by the year 2020. And where this comes into play is when we start slicing the data and looking at how we're progressing, we weren't getting there. And the ways that we weren't getting there, the barriers were not on our quality improvement initiatives or our research outcomes for treatment. They were the social factors and our work in our communities. And so really looking at reframing ourselves as an organization, focusing squarely on health equity and looking at those social determinants or social influencers of health. So knowing that there's kind of a story we tell of, a man comes in to see his doctor and he has high blood pressure and he's not taking his medicine, and the doctor's like, why aren't you taking the high blood pressure medicine? He's like, because I don't have a job, right? So there are barriers. If people cannot get access to healthy foods, it doesn't matter if we educate them on eating so much fruits or vegetables or reducing sugary drink content if they don't have access to it or don't have income stability or access to transportation or access to safe places to have physical activity. So we've really looked at, in order to have the progress we want to have in improving healthy lives, we need to look at root causes and shifted our work that way.
Right, and to build to that, so if you think about what Dr. Gayle was talking about and also Lisa, a lot of times when we talk about health, it's kind of a reductionist way of thinking about health. We need to get rid of the bacteria or we need to get rid of that virus. So if you think about, on average in a year, you maybe see your doctor 5 times. So what about the other 360 days of the year that impacts your health? So it really, determinants of health is really about the conditions that impact where you live, work, play, and learn. And at Blue Cross Blue Shield, we've been very intentional in thinking about health very holistically. So we've focused it on 4 areas. One is we see housing as a health strategy, and I can talk a little bit about that later. We've also looked at behavioral health because we know as a healthcare system, the power that we have is we have data, right? So not only data from claims data, but we also have data that everybody has access to, CDC, what's going on locally, Chicago Department of Public Health. So we know that, behavioral health, linking that to address issues is very important. Our third focus area is around violence as a public health issue, right? And we've got to think about it as a public health issue. We've heard in a lot of speakers earlier this morning talking about it, but as an insurance company, thinking about it as a public health issue allows us to be able to talk about it in a different way. And then lastly, general access to care. A lot of times people think you have a health insurance, right? You show your card, that's access to care. No, it's not, right? It is access to your doctor, but access to care also talks about, is there information in your language? Is there health literacy? How can we navigate you to the services that you need? So that's how we think of social determinants of health, the things that impact your health outside, the bacteria and the virus.
In Chicago, there's been a lot of work looking at the health disparities. And, the most recent one showed that if you live in Streeterville, your life expectancy is 90 years. If you live in West Garfield, it's 60. Huge. I mean, that's a greater disparity than we see between many countries, the U.S. and many countries around the world. So, huge and unacceptable. And we know that zip code plays such a major role in determining people's life's outcomes. How are you all thinking about the key root factors, and what are the things that you can do, and where do you think about partnering with others? Because I think one of the challenges when you're a health-focused institution, it's hard to take on all of those challenges. What role does partnership play, and how are you thinking about this notion of zip code as destiny?
Yeah, I think partnerships is really key. And when I talked about housing as a health strategy for us, that's one example of that. So, we are currently there is over the next 2 years, we're doing $1 million in investments in housing. And how we're doing that is through partnership. We're partnering with Presence Aurora Health. We're partnering with Chicago Department of Public Health. We're partnering with UI Health. We're partnering with Chicago Housing Authority. So as you think about health, we want to make sure we partner with the organizations doing the work. So the focus around that is looking at the data. And so what exactly were we looking for? Well, hospitals see this, health insurance companies see this, a lot of partners see this. So we're looking at individuals who are homeless. And we were looking at the data and seeing that they were frequent users of ER, but also other critical care services, right? Such as shelters, paramedics, et cetera. And so the thought was, what is the core issue in causing that? And the issue was around stable housing. Because if you think about it, how can you really address your health issue? How can you even find a job if your housing isn't even stable? So we are investing in identifying those homeless individuals that are frequent users of those services and providing rent funding. So it's called the Flexible Housing Pool. It's a partnership between the city and private donations to provide housing for individuals who are homeless. Because what's the long-term impact of that? By having stable housing, you're able to, right, address your healthcare issue. A lot of times when you're looking for a job, you need an address. And so economic stability, that also addresses. But so really looking at these social determinants of health, you really get at the root cause of the core issues on how to impact an individual's healthcare.
Yeah, absolutely. And I think partnership is key. You know, there are so many amazing organizations that are experts in one arena or another, but these are complex issues that build on each other. You know, they're not siloed, they're interconnected in someone's everyday life. So we've really committed to using a collective impact model where we look and say, okay, as the AHA, as a science-based organization that has boots on the ground in communities across America, what value can we do? What role do we play? And then find those like-minded partners that play a complementary role with a common goal to achieve that collective impact. And that's really the strategy that we feel is a must in order to move forward. No one entity can do it alone.
One of the most impressive projects I've seen that is addressing the social determinants of health is here in Chicago, and that's West Side United. Mm-hmm. You know, they looked at the fact that of this, they were looking at a 19-year life expectancy gap, but nonetheless, you know, looking at the life expectancy gap and said, we can't do this by addressing health and healthcare alone, and it put together a pretty impressive coalition across the city, looking at economic opportunities, jobs, public safety, education, and nutrition, I believe. I know both of you in some way or the other are a part of that. Would you talk about your experience with that and how you think that sort of very broad approach is making a difference?
Yeah, absolutely. So we get to work closely with West Side United, which is a really phenomenal initiative, as you mentioned, coalition. It was founded really on the backbone of 7 healthcare institutions, and to your point, really looked at in West Side neighborhoods, there's about a 16-year life expectancy gap between the Loop and many communities on the West Side. So we know there's some larger gaps in Chicago, but that's sort of the data we started with, or West Side United started with, and set a goal to cut that down by half. And a lot of that is investment in jobs, hiring from the community, but there's also a lot of work where we get to come into play around blood pressure management. So very specific, working not just with the large healthcare institutions, but the FQHCs, the federally qualified health clinics. Community right now, we just announced in partnership with Blue Cross Blue Shield. So really exciting, talking about partners make everything happen, an investment in West Side United just last week that will fund community health workers on the ground around some of the blood pressure work. So there's a lot of ways that we're engaging in that space. That's one of the key ones, I think, but it is a pretty impressive collective that's doing some great work.
And I just wanted to say, too, the community health worker model, I know this is a very old public health strategy that's been going on for hundreds of years. And what we're finding now is that a lot of organizations are seeing the impact of community health workers. And the fact that we're funding the Westside United, I think, in partnership with the American Heart Association, says what the importance of collaboration is. Because what we do is you build from what the community assets are. So you're not looking to replace or take the place of, but you're looking to build from where the expertise is.
Yeah, so you mentioned community, and I think a lot of times when we think about health, even if we're thinking about the social determinants of health, we think about organizations, and we don't think about the community that we're trying to have an impact. How have you engaged community in your work, and how has that shifted the way you see your work and the way you do your work?
Yeah, absolutely. So I like to use the term understand. So just even by breaking up that word, right? Under means you're not a place of power, but you're in a place where you don't know. And to me, the most important thing in working with neighborhoods is to understand, where you're not coming from a place of power, but from a place of trying to understand. And so one of the ways in which we were able to do that is when we opened the Blue Door Neighborhood Center in the Pullman community. It's our first center looking to do health and wellness, provides health literacy, health promotion, education, care coordination, and also an opportunity for community members to come together, do some organizing. We have a free space for community members to use. Even the way a lot of times the general rule is, build it and they would come. That was not our point of view. Our point of view first was to seek to understand. And how do you go by doing that? I think from public health does a really good job in understanding community organizing. I come from a community organizing background, working with the Asian American Health Coalition. And so what we did was community organizing one-on-one. And so what that meant was doing community listening sessions, right? So understanding what do community members, across the age spectrum, from youth all the way to seniors, what are the pastors saying that's important? What are the aldermen that are doing? What are working families saying? So it's really seeking to understand. And we hosted these events at various venues, right? So when we talk about community engagement and understanding, we want to make sure it was early morning. Is it during the evening to accommodate working parents? So we really sought to understand what the needs were. So as a result of that, we prioritized 6 focus areas, and that was nutrition, diabetes, heart disease, asthma, behavioral health, and behavioral health and general access to care. And so the way we're able to get that, understand the needs, was actually listening to the community and let it be community-led.
Yeah, absolutely. I agree. As we entered deeper into this space, one of the first things we did was our own community health needs assessment, in a sense. So not the public health data that we have access to. We use that, but to supplement that, it was the anecdotal data from going around and talking to members of the communities that we serve and doing listening tours and gaining insight about what some of those barriers were. What were the things keeping community members up at night? What did that look like? So that's a core part of our work from the inception. And then I'd say from there, it was really looking at understanding that where we and others have likely failed in the past is to come into a community with a pretty program, right? Drop it there and do it for a year and then say, okay, bye, and then see what happens, because it's not a sustainable model and doesn't impact real change. And sometimes it's not even what the community wants or needs. So we really needed to look at community-led desires for those interventions, but also community-based solutions. And how can we take what's already thriving or doing well or having an impact in one of our communities and help it excel or support it or move it forward in some way. Because the people that have the best solutions are the ones that live, breathe, work, play in the communities that we're serving. So it's really looking at how we can be a complement to that and not come in and take it over.
Mm-hmm. You mentioned housing, and I think housing is one of those very fundamental issues that has an impact on health. But increasingly people talk about economic mobility, economic security. Right. How are you all tackling that issue, and what are the other key issues that you think are important levers as we think about this model of social determinants, and how hard is that for you to address those?
Well, we think about, so other the key levers, so I think about personally too. So first generation Filipino American. My parents came here. My dad was actually U.S. Navy, so working class. And I feel like the equalizer for me was really education. So as we think about, so how do you provide opportunities for education? So part of that is thinking about, so how do you do mentoring programs? How do you even do the pipeline around education? The other thing that we're addressing, I think specifically, is around kind of economic development, and part of that is around job opportunities. So for example, we are currently opening, it's called Chicago South. It'll include our Blue Door Neighborhood Center, but it's also going to be including some of our other work around customer service that's going to provide 550 jobs in the Morgan Park neighborhood. So as we think about economic development, we want to be very focused around what it is that we're doing and being very intentional. So even how we're engaging with Morgan Park, right? Part of us is understanding what are some of the needs within Morgan Park, who are some of the community-based organizations already doing really good work around job development, like the Chicago Cook County Workforce. So again, partnering with organizations, looking to build from what's already there and going from there.
Yeah, absolutely. I think so. We are not a huge employer, right? We're not an organization that is an expert in public housing. But what we can do and what we can bring to the table is, we know a lot about healthy food and healthy access to food and addressing food insecurity. So when you look at any community hub, what role can we play there, making sure that where there is public housing or complementing a group like Blue Cross that is doing work in that area, by making sure that there's healthy access to food. One of the big problems is food deserts, or on the flip side, food swamps, right? So it's not technically a desert because there is access to food, but it's fast food, or it's the corner store with pop and chips, and maybe there's a carton of milk and eggs, but not much else there. And that's a space that we can come in and have a real impact using our advocacy arm, using our science, our data, some of our initiatives there to help improve access to healthy foods. Also, some may be aware, Chicago has a complete streets ordinance, a complete streets law. But when you get outside the loop, that's not always really enforced there or available, because there's a law, there's not funding for it. So access to safe places to walk to school, walk to work, walk to church, to play, to exercise, that's another area that we can come in. So there's two examples of that, but really looking at how do we complement the whole picture to make sure that we're building that healthy community ecosystem and not just addressing one piece of the pie. So really complementing that.
We often talk about the health disparities here in Chicago, and talk about South Side and West Side. And in many ways, that's a euphemism for Black and brown communities. Mm-hmm. And I think the issue of race and racism and the systems that have developed as a result of that are an important part of this picture as well. How has that entered into your dialogue, into your thinking about how you address these issues for the communities you serve, and then how you as an institution are thinking about those issues of race and its impact on health?
Absolutely. We're always looking at ourselves in that too, and trying to improve in that area of building an inclusive work environment, and incorporating diversity and inclusion in everything we do. In our vendor selections, kind of across the board, we've taken a hard look at that as an organization to make change. But some of it too, and why partnership and community is so important, is it doesn't matter what you're saying if you're not speaking with a trusted voice. And race plays into that. The conversation I think Rami was saying earlier, or someone was mentioning that dialogue of, well, they don't look like me, or they do look like me, and then that's why I think they can't do something. But on the flip side of that, that difference that comes to play in our social structure around racism is a thread through everything. So I think we have to be very open and listen and acknowledge and build our own trusted voice, but also engage advocates within the community to have that trusted voice to make impact.
Mm-hmm. I think inherent on, so the role that I play within Blue Cross Blue Shield of Illinois is through our community investments. So we invest within communities, we do long-term investments. And our point of view is really around how do you address health disparities. So in recognition of that gap is a recognition of, racism and its impact in whether communities get invested in and whether they are not. And I think the American Public Health Association really said it best when it identified race as the #1 public health issue we need to address as a country. And the way we look at it as an organization is really thinking about where are the gaps in care, where are the gaps happening. Looking at it structurally, right? So what's happening structurally, but also looking at it from, within our system too. Are there opportunities for us to do a better job, whether that's health literacy or care coordination, to make sure that all communities have the systems that they need or navigation to need to get the care that they need.
Mm-hmm. Another issue that I think plays large in terms of health and health disparities here and perhaps even more globally is gender. Mm-hmm. How are you addressing issues and the needs of women, and in the context of the social determinants, thinking about women's lives holistically and what that means for how you think about the programs that you are involved in?
Mm-hmm. Yeah. So I'll start on that. We have a campaign called Go Red for Women at the American Heart Association that's been around for about 15 years. And it really was one of our strongest, longest lasting health equity campaigns. And that's how we really look at that, because we knew that when it came to heart disease, women didn't know they were at risk for heart disease. They weren't being included in research and clinical trials. It was studied as a man's disease. It was treated as a man's disease. And in truth, a lot of diseases, not just heart disease, present differently in women than they do in men. And so we started a campaign to build awareness, but also to change the innate inequities in the structure, all the way back to the research point of studying the diseases and studying health in the heart and the body, so that we can really make some changes from within. We're bringing that now to a STEM workshop for young girls to really get more women in the field. We need more women in the field of medicine, of health, of the sciences, because they're going to bring that viewpoint to their work, and that will impact how we have outcomes moving forward.
When I think about gender, I think about it from a couple different levels. So one is from a programmatic perspective. So from looking at addressing community health issues in Illinois, how are we talked about a lot about representation, right? I think our first session this morning was about representation. So are women represented in the programs that we're looking to address when we think about health disparities? But I also look at representation in terms of our staff, right? So we're all, hiring managers. How do I think about representation in terms of staffing, right? So I think about that in the team. There's some team members right here, because I think that when you have different voices thinking about a problem at a neighborhood, community, city, right, county, and then state level, that's how you're going to be able to address what the issues are. So I think about it in multiple ways.
I think we're going to open up to the audience in a minute, but let me ask one question, and maybe we'll get some more. But what you measure often is what gets done. And when we think about the social determinants of health, it's really broad. It's hard to take on whole society. Healthcare organizations that are focused on certain metrics that you've got to meet. How do you think about this whole area of what you measure, what that means for social determinants of health, and how you get your work done?
There's really not an easy answer to that, is there? I mean, there's so many.
Responsible for the whole system, but,
right? Yeah. And I mean, so an important measurement for us and our piece of the pie, it's not the whole system, is certainly looking at life expectancy gap, and are we moving the needle to reduce that? We also look at health spans, not just lifespan, average health age, but how many of those years are healthy. Right, so if you are living to 80, but your last 20 years are not healthy and they're poor quality of life, that's not what we're setting out to do. So we're really looking at health span and measuring that. And so there's ways to do that by looking at overall health ratings that are self-reported, or days, a 30-day, look at healthy days, how many are healthy, and there's data there too. And then of course we're always looking at the public health data around blood pressure rates and CDC data around what people are dying from and all of that. But it's a complex thing, and there's a million different ways to measure it. So it's a tough one.
Yeah, that is a tough one. I think the way we've broken it down is short-term, intermediate, and long-term, right? So I'm going to go backwards. So our long-term strategy or measurement is have we made a health condition either stabilize or get better, right? Intermediate is really around, is there some type of behavior change, right? Have we made something better, whether that's systems navigation where, like for a simple example would be care coordination, right? So for example, if someone with diabetes, and can we hook you up with a care coordinator who will then help you navigate to get the services that you need? So have we made the system easier? And then the first phase in terms of short term is really thinking about engagement, because you can't do any of that trajectory if you don't have the engagement. Engagement means truly understanding what the needs are, understanding what the root causes are, and then looking to see what it is you're looking to change. So I think by thinking about it that way, that's how we're looking to measure. So we do look at some of our claims data to see, if hemoglobin A1C has either gotten better or worse, but we kind of combine that with both kind of clinical outcomes, but also looking at behavioral change in the populations we are looking to serve.
Great. Let me open it up for questions from the audience. Are we coming around with mics? Here's the first one over in front here. Right here, yeah.
Thank you.
And she can bring the mic to who's next? I saw a hand back there too.
Hi, Stefan Bogner with the NYDG Foundation. We looked at the socioeconomic factors of health and housing and partnerships and health disparities. What are you doing with the environment? We talk about ecosystems, but how are you helping to build green spaces and parks in those low-income housing? Because the data is out there and showing the important role of green spaces in mental and physical well-being. It's out there. The UK did a great study in showing they looked at the metro line, and life expectancy was higher in those neighborhoods that had more parks and more green spaces. Right. So this ecosystem that you're trying to build, are you investing with the U.S. National Park Service or Parks Chicago, Parks New York, to build these green spaces in all communities to make sure that people have access to parks, where parks are not closed, and working with doctors to give them prescriptions so people can access them. So this ecosystem, does it include parks and green spaces and working with those medical practitioners to get the patients out for a walk? And the importance roles of trees in biophilia. That was my ecosystem in terms of green spaces.
Mm-hmm. Yeah. I think that's definitely part of it. I mean, air quality is a factor in influencing health. We are, for us organizationally, when we look at climate change and the impact on health, we are just now coming to a place to determine our stance on that. But some of the things are obvious, right? We know that green spaces and parks, those are sort of two different issues. There's the environmental factors, but then there's also the fact that parks and safe places to walk, that's physical activity and exercise, which we know we're founded in. And so we're certainly supportive of addressing that and making sure that it's comprehensive and including green spaces and safe places to exercise, but also improve air quality. And a lot of our air quality has initially focused historically on indoor air, clean indoor air policies, which we've been a huge mover in and advocate for, and had some great success in that, but that's shifting now and evolving as it needs to.
So I realized that I totally screwed up the time. We're actually out of time. We don't have time for any more questions, but I hope that this has been an engaging discussion, and I hope that when you think about contributions you give to the American Heart Association, and when you think about insurance, you switch to Blue Cross Blue Shield if you haven't already done so. I hope you see these are great representatives of their organization and doing great things. So thank you.